President Aquino ordered the Department of Health to intensify efforts in locating the passengers of the ETIHAD Airlines flight EY0424 who need to be screened for possible Middle East Respiratory Syndrome coronavirus or MERS-CoV infection. Last April 15, a returning OFW who worked as a nurse in the United Arab Emirates was tested positive for MERS-CoV upon arrival here in the country. On April 19, however, the DOH announced that recent tests showed that the OFW was negative for the virus. Communications Operations Secretary Tani Coloma said that the DOH continues to contact more than 200 passengers of that flight.
As of 8 a.m. today, 173 out of 414 passengers, or 42%, have been contacted. Of this number, 100 passengers, or 24%, have been tested. We are awaiting results of the tests on the 73 other passengers. All 100 passengers tested negative. The President instructed the DOH to ensure that all the passengers undergo a free nose and throat swabbing test for the MERS coronavirus in all public hospitals or DOH-accredited medical facilities. To coordinate directly with the DOH through its 24-hour hotlines. Landline numbers are 711-1001 or 711-1002 and mobile telephone numbers 0922-884-1564, 0920-949-8419, and 0915-772-5621.
Middle East Respiratory Syndrome, or MERS, is a viral respiratory illness first reported in Saudi Arabia in 2012. It is caused by a coronavirus called MERS-CoV. Most people who have been confirmed to have MERS-CoV infection develop severe acute respiratory illness. They had fever, cough, and shortness of breath. About half of these people died. So far, all the cases have been linked to 6 countries in or near the Arabian Peninsula.
Napaka-importante pa rin dito, time and again, yung palagi nating ina-advocate noon pa, yung cough manners, na yung cough etiquette, tsaka yung proper hand washing, because this will help in preventing the spread, the same way in protecting yourself as well.
This virus has spread from ill people to others through close contact. However, the virus has not shown to spread in a sustained way in communities. The situation is still evolving.
Meanwhile, the Department of Foreign Affairs and the Department of Health advise Filipinos and release the following guidelines for protection against the disease. Number 1 is to practice proper hand hygiene always by washing your hands with soap or hand rubs with alcohol before and after eating, before and after handling, cooking and preparing food, and after coughing, sneezing and using the toilets, and before and after touching animals. They also suggest to practice proper cough etiquette by covering your mouth and nose while sneezing or coughing. Use a facial tissue when coughing or sneezing. Avoid contact with farm and domesticated animals, including camels. Avoid contact with sick or infected with MERS-CoV. If you have respiratory illness, stay home and wear a surgical mask to protect your family members. And to visit your doctor immediately if symptoms of MERS-CoV manifest itself, and that includes persistent coughing and others. Saudi health officials confirmed 42 new cases of the Middle East Respiratory Syndrome coronavirus, or MERS-CoV, in the kingdom over the last week, and 7 of them were fatal. Yemen, Malaysia, the Philippines, and Greece also reported their first cases last week, all linked to travelers from the Gulf. The health ministry said on its website MERS, a SARS-like novel coronavirus that emerged in Saudi Arabia 2 years ago, has infected 244 people in the kingdom, of whom 76 have already died. MERS has no vaccine or antiviral treatment, but international health experts say it does not transmit easily between people and may simply die out.
I've invited the 5 leading companies known to the scientists vaccination industry. We have sent them letters to invite them to collaborate with the Ministry of Health. They have answered us, and we know some of them are going to visit us soon. We will ensure that any copyrights will ensure that this will bring those vaccinations or therapeutic measures at a cost that is affordable by countries.
Researchers from the National Institute of Public Health and the Environment and Erasmus University in the Netherlands said it has been extraordinarily common in camels for at least 20 years and may have been passed directly from the animals to humans.